She is rooted from Srirangam and did her masters in Bangalore. Now looking after the international collaboration of entire 14 countries and across globe, being a senior director of Single, she is the right person to talk about this international collaboration. And she is the right person to have this word. Enna valam illai indha thirunaatil uyarum un madippu ayalnaatil. You are the best person to tell this because we are ready to take பன்னாட்டு பயிற்சியினை ஏறெடுப்போம், ஒருங்கிணைப்பு திட்டங்கள் திட்டமிடுவோம், செவ்வனே செய்திடுவோம், உலகிற்கு எடுத்துக்காட்டாய் மாற்றிடுவோம் எங்களது பொது சுகாதாரத்துறையினை. அதற்கு உங்களது ஹெல்ப் எங்களுக்கு எப்பவும் தேவை. ஓவர் டு யூ மேம்.
Excited, Dr. Nivalson. I forgot my mic. Ellorukkum vanakkam. So happy to be here today to represent both India and Singapore. எப்படி சொல்றதுன்னு தெரியல, ஆனால் allow me to, he has given me a big introduction. Dr. Nivalson, thank you. First of all, Director Selvaraj அவர்களே, Dr. Vinay, and all of you here. காலையிலேருந்து we are listening to such eminent speakers. Thank you so much. பட் நான் கதை சொல்ல போகிறேன். நான் எமினன்ட் ஸ்பீக்கர்ஸ் மாதிரி கேட்குதா எல்லாருக்கும்? ஜோராக கை தட்டுறீங்களா எல்லாரும்? அட் த பேக் ஆல்சோ ஐ வாண்ட் டு ஹியர் கிளாப்ஸ் பிகாஸ் யா தேங்க்யூ. ஸோ நான் என்ன கதை சொல்ல போகிறேன்னா, நான் என்ன படித்தேனோ, இங்கே இந்த ஊரில் என்ன படித்தேனோ, அது எப்படி வெளியூருக்கு போய் அந்த எக்ஸ்பீரியன்ஸ், இங்கே படித்த எக்ஸ்பீரியன்ஸ், இங்கே இருக்கிற எக்ஸ்பீரியன்ஸ் வெளியூருக்கு போய் அது எப்படி எக்ஸ்பீரியன்ஸாக மாறி எல்லா ஊருக்கு போய் நிறைய ஊர் ஏன் பண்ணுறோன்னு ஒரு 14 கண்ட்ரீஸ்ன்னு சொன்னாங்க. ஆல் ஏஷியன் கண்ட்ரீஸ். வி ஹவ் ட்ராவல் டு மெனி கண்ட்ரீஸ் டு டூ கொலாபரேட்டிவ் ஒர்க், ட்ரைனிங் அண்ட் கெப்பாசிட்டி பில்டிங் ஒர்க். எதுக்கு பண்ணுறோம் இது நாங்கள்? why we want to do this? Singapore has a 6 million population. And you know, சிங்கப்பூருக்கு பேர் எக்ஸலண்ட் கண்ட்ரி. வேறு பிராண்ட் அம்பாசிடரே வேண்டாம் சிங்கப்பூருக்கு. சிங்கப்பூர் ஆஸ் அ கண்ட்ரி, இட் இஸ் பிராண்டட் ஆஸ் எ ஒன் எக்ஸலண்ட் குவாலிட்டி country. But still Singapore is reaching out. As you see in my slide up there, Singhal Duke NUS, Academic Medical Center, beyond borders. That is what is our tagline. So we go beyond borders. We are not limiting ourselves to Singapore. அந்த சின்ன ஊரில் உட்காந்து நம்ம வேலை செய்யணும்னா the population mix is going to be very small. We need to go out, learn from others, also contribute. I think Singapore healthcare has gone slightly ahead of the curve. I think our age expectations and rates have all increased based on the WHO standards and UN standards. So we need to share what we have done. For that reason, we go beyond borders, okay? And while doing that, we are very happy. We also learn from everybody, okay? We learned a lot. Thank you from Tamil Nadu. We are doing a maternal child health program for many years. People who come back after doing the program, they've always told us that they have learned a lot, okay? So thank you so much for the opportunity. Health inequalities across Asia. So here is where the world is. People in the past spoke about US, UK, going to Europe, going to Switzerland. I think forget it. Come back to Asia. This is where your population is. This is where you will find the demographic that you need to see. No more West is the best. I think Asia is the best. So you find all mixed here, demographics, epidemiological profiles, and also health systems. Look at the growth in the health systems across all the countries. Nothing is stagnant. I think you have presented, I think from morning I'm listening to all of you, presenting the growth prospects, each of the suggested topics. I think salt was overly presented today. So, but every state is doing so much better than what it used to be. Shifts in disease patterns, rapid development of medical technology, rising costs, and expectations from the patients. I think all the doctors know here, whoever is sitting here, and future doctors who are sitting here, you know that patients come with their own diagnosis now because they're so advanced in the medical technology, and Google it, you know what the diseases is. So they come to you, challenging you to give you the right treatment, okay? And yet, there are a lot of health inequalities, continue to persist across Asia, and the three things that are very important is economic stability or instability from these countries, and you also know a different population demographics and social and cultural values. I think the speaker just mentioned about being a vegetarian or not being a vegetarian puts a lot of impact on the way you treat your patients and also on the health systems. So what did we do? This is the story. So Singapore planned our action. We started moving to, not moving actually, looking at countries in and around us. Singapore is really, within a gap of about distance about 3 to 4 hours, you can reach most of the countries in Asia. I think the location is very good. So with this geographical location, we took advantage of this and we started engaging our neighbors such as Indonesia, Malaysia, Brunei, and name it, around the country. We said 14 countries, including India and China. We have gone to that extent. Looking at how we can learn from each other. There are certain topics, certain interesting topics from each of the countries. So we actually worked with the governments because, of course, Sing Health is a public sector healthcare group, and so is NUS, which is a medical school, both being public. So we started engaging the government sector in these countries first to build a reputation, to build a relationship. People spoke about collaboration. It doesn't happen overnight. Collaborations happen over a period of time and with an effort, continuously knocking on the doors of people and telling them that we mean well and we want to really come to you and learn from you and we have something to offer. So building this, as I said, we have with the International Collaboration Office and the Sing Health Duke NUS Academic Medical Center Global Health Institute, we have more than 230 projects all over Asia. Some may be over beyond Asia as well, but mostly located, as you can see all the red dots that's here. These are the projects. Because of the success, we thought we shouldn't stop where we did. We actually developed this collaboration and really set up an institution called the Global Health Institute under the Sing Health UK US. Now, the learning did not stop there. The 5 core focus areas for us is policy. Now, again, I think one of the speakers also emphasized on management and policy level interventions for all the work that we do. So this Global Health Institute also has a policy and research, very important. Innovation is becoming more and more important, and clinical, without doctors and nurses and training of them becomes, healthcare systems are not really effective, and education. These are the focus areas of the Global Health Institute. Now we have enabling platforms. From these cores, we have enabling platforms. We have developed the Center for Outbreak Preparedness, Asian Institute of Healthcare Leadership and Management. I think our Professor Ong is going to be sharing a little more on that on the next one. We also have Global Health Regional Collaborating Centers. I will share that in a little while. We also have an evaluation unit under Center for Global Nursing and other programs under the Global Health. Now, this is where we have done all the work in the region. We focused on maternal child health emergency and critical care, disaster management, burns management, nursing specialists, hospital management, patient safety. I think I've heard all these topics in the morning that the speakers were asking to, said these are emphasis area, especially patient safety and quality and, nursing areas. So this is where we went to all these countries. Why did we go to these countries? I give you an example of the burn center we did at the national level in Bangladesh. We used to receive, because Singapore General Hospital is the Asian center for burns treatment. We could actually save burns, even up till 75%, 80% of burns, we could save the patients. So a lot of patients came to us from Bangladesh. I'm quoting a country here, but I think very often it's actually a pandemic in the country. They have a lot of burn issues. We used to receive a lot of cases from the country. Sometimes we couldn't save the patients. They came all the way, but we felt it is such a, we couldn't save. We used to feel very sad. Could we do something about it? And that's how we engaged the National Burn Center in the State Institute in Bangladesh. We trained the doctors, the nurses, and the technologists, the speech therapists, and the whole lot. And the story is, it's really a global health story. Today, we do not receive any case to Singapore. The reason is, yes. Ellaru kai tattangle. Sorry. So the reason is, of the training, we still have a good engagement with them. Our doctors and nurses still have a very good, they can call our doctors if there's any issues and they can talk to them. So this story, I tell you, is fantastically, and they got an award for this. I think WHO gave them an award for implementing this, nationwide. This also led to a government policy, because we also engaged the government in a policy level discussions. Government policy of opening up 7 more centers for the country, because I think there was shortage of places. They opened up, and the people trained by us, they were posted in these 7 places. So this is a very good example. Emergency critical care, not in Nepal, in Karnataka, we did an emergency and critical care program. I think they have also reported the numbers have, the intervention and support has helped them to, develop better. The next one is disaster management. We did this in a few countries. We did this in Nepal. So I must share again that, I don't know if you recall, there was an air traffic accident in Nepal. I think it was again a flight from Bangladesh that went to Nepal, landed there, yes, and some people died, and they actually carried some of the medical students from Nepal who were studying in Bangladesh to Nepal. Now, we had just started the program, and 1 month before this accident, we had done an exercise exactly on aircraft, airline disaster. And people who were engaged in that, they actually reported that they could save more lives because of the training that they received from the disaster management teams. So some of them were moved to, of course, Singapore because they needed more treatment, but we worked with them bilaterally, and I think more lives were saved. We still continue to engage them at the national level. They're setting up the National Disaster Unit in Nepal. Again, this is, most of this I've already explained about the Burns Institute at the Sheikh Hasina Burns Center. Survival rate, as I said, has really has improved. And the medical and critical care in Cambodia, that was again a national program. As of today, after training them, we are talking to the national government, Ministry of Health in Cambodia, to set up the cardiac arrest national program for the country. And we are starting up with a little small research so that we have evidence-based setup in this country. Again, the hope is to work with them long-term and make sure that we leave behind trained manpower so that they can help the country to take care of themselves. Okay. In Calcutta, again, we did a program in West Bengal, Calcutta, that was again under the guidance of the Chief Minister of the state. She's the health minister too. We supported the training in the ICU setup. It was done by anesthesiologist. That's again a very nice, very interesting, project that we had. And I heard that this project also received the National Government Award from India. Just sharing the disaster management program, some of the clips here. This is in state of Madhya Pradesh, also MCH program. We are continuing to do a research program with them so that we are in touch and we can, add on value there. This is from Indonesia. Academic Medical Center is the university, Hasanuddin University in Indonesia. Today, I think because of the planning, there is a master's program in emergency medicine, in disaster planning as well. So they supply the entire manpower for the whole nation post this program. Okay, so again, our faculty members are very much involved, continue to provide the support, and also they teach at this university for a long-term initiative. Nursing is a very important component when you do healthcare. So we set up a global nursing platform under the Singh Health Duke NUS. This supports all the regional training work that we do in Singh Health. So it's really to equip nurses to provide quality care, exchange knowledge, and train advanced practice nurses, because I think we're getting more and more tertiary in our work practices. I think that's why we continue to train more nurses. We also have master's degree in nursing, specialized nursing program, healthcare management projects for nursing, collaboration with hospital and universities. We also do patient safety and quality programs across all countries that actually benefits both the system level and also the patients, because they know the quality healthcare. They have a lot of confidence when you say that you're certified, either ISO or is certified by JCI certified, the confidence with patients is very high. We also have healthcare leadership management. I think Prof. Ong will be the one talking about it a little more. The experience has been fantastic. We engaged more than 14 countries in all these regional countries to come together and form a network of leaders. I think they now have an avenue to talk to each other and share what they do in their countries for better prospects and better network. So this is, I will leave this to Prof. To talk. The last is global surgery. This is the last one that we also do. Some countries didn't have surgical facilities sometimes, in remote areas. So especially, I give you Papua New Guinea as an example. They had an average age of 48 years about 15 years ago. All of them would drop dead at that age. Not all of them, at least majority of them, especially men. And so with intervention from the research group, we found that, of course, the habits that you're all talking in the morning was very predominantly evident, and the NCDs were not really well managed. So what do? Australians went there very often to do surgical interventions, but that was not enough. So we happened to bring back the cardiologists, cardiac surgeons, perfusionists, ICU nursing, train them. I think they are independent now. As of today, they have done more than 1,500 interventions in their own country without depending on anyone. Okay, and that's a story that we think is very engaging, and especially the training bit and the cooperation. This is the Sing Health Bring Smile, and some of the other projects I won't share much. So all this gave us experience of we need to continue to continuously engage our partners. So we have set up 3 regional collaborating centers, one in Sri Lanka, one in Vietnam, another one in Indonesia. We hope through this we build more bonds beyond Singapore and bring in the expertise and jointly share research with these 3 institutes and beyond. Sorry, I spoke in English more of the time. I was supposed to start in Tamil and end in Tamil. A little bit of sharing, and thank you for this opportunity. Really, really thank you so much. Thank you.
Thank you, ma'am. Dr. Vijaya, ma'am, you can come and wait here till. Start.
Thank you, ma'am. We request Dr. Cheran sir, Director of Institute of Community Medicine, Chennai, to felicitate the speaker.